If you were in an accident or suddenly became ill and were brought to an emergency room unable to communicate, would a doctor know your medical history? How about which medications you were taking? That information could save your life, and the doctors need to know it fast.
Health insurance carriers have the most current and probably the most accurate information about a patient. We gather information about hospital visits, physician visits, prescription drugs, laboratory studies. We can get that information to the physician, giving him or her the opportunity to make better informed therapeutic and diagnostic decisions, ultimately resulting in better outcomes and better quality of care.
More complete information means healthcare professionals can make better decisions.
Physicians rarely have all the medical information that exists for a patient. We make incredibly important decisions based on data that isn't nearly as comprehensive as it could be. Filling in the additional blanks with patient information is tremendously advantageous to us and our patients, and ultimately to the entire healthcare system.
The solution to the problem, like most in this age of information, comes down to technology, or more specifically, the exchange of health information. The patient clinical summary is an electronic health record that provides a common view of a patient's medical history by summarizing and clinically validating data from claims, pharmacy, and care management sources and delivering it to users at the point of care. It is created using data that exists within the walls of the patient's health plan.
When I was in practice, patients would see me and they would not have a clear recollection of surgery that they had had, when they had had the surgery, or even recent laboratory tests. As we have that information and we can give it to their physicians, we know that we can improve the quality of care and speed up the resolution of whatever illness or problem the patient has.
The data that physicians have on file is rich in detail, but it is limited to those interactions between each individual doctor and each individual patient. The PCS offers a much broader view of a patient's healthcare-related activity, other doctors they've seen, tests they've had, medications they've taken, what treatment opportunities exist. This is potentially difference-making information in the treatment process and makes the PCS tremendously useful and unique.
The United States healthcare system is being severely constrained by a lack of clear, concise, and complete patient information. The federal government has already called for a shift toward electronic health records for all Americans. Developed by Pennsylvania-based MedDecision, the patient clinical summary delivers critical information to physicians when and where the patient is being treated. For more information on how MedDecision's industry-leading products and services can help your business improve and prosper, contact them today.